Questions 801 to 820. 801. A client in the second stage of labor is unable to push and lacks to bear down. What is the most appropriate next step? A. Assess fetal descent. B. Infuse intravenous fluids. C. Empty the client's bladder. D. Administer oxygen to the mother. The answer is A. Assess fetal descent. 802. Patient with a spinal cord injury states, I have no constitution, I can't do anything for myself. Which of the following best describes this patient condition? A. Powerlessness. B. Delusions. C. Suicidal. D. Resignation. The answer is A. Powerlessness. 803. A discharge planner is reviewing the file of a patient and move him from the acute care to home care. What activity should the discharge planner to do ensure the co-care? A. Make referral to the appropriate department. B. Visit patient's house to make sure it is safe. C. Call pharmacy to prepare medications for patient. D. Organize transportation for patient to be moved to. The answer is A. Make referral to the appropriate department. 804. A newly assigned nurse to the home healthcare department was conducting pre-entry phase of home visit. Which of the following activities should the nurse do? A. Call physician for referral order. B. Collect information and schedule a visit. C. Establish mutually acceptable goals for care. D. Conduct a health history and physical assessment. The answer is B. Collect information and schedule a visit. 805. A nurse was educating a group of women on prevention of infection. The nurse asked each woman to state one preventive of vaginal infection. Which woman needs more education? A. First woman, keep vaginal area clean and dry. B. Second woman, wear cotton underwear. C. Third woman, wipe from front to back after urination. D. Fourth woman, do vaginal douche twice a day. The answer is D. Fourth woman, do vaginal douche twice a day. 806. A 9-month-old child who has had 4-ear infection 6 months is being discharged. Which statement by the parent indicates the need for teaching? A. I should never put my baby to bed with a bottle. B. My child should not use a pacifier after age 6. C. My child should drink his bottle while lying flat. D. My child should not be around people who smoke. The answer is C. My child should drink his bottle while lying flat. 807. A mother who is postpartum calls nurse in the mother/infant unit. She reposts has very heavy bright red bleeding. What would be the best advice to give her? A. Don't worry about it, it is normal. B. Call your doctor and ask what to do. C. Lie down, massage lower abdomen. If it does not work, to the hospital immediately. D. Lie down for about an hour. Then check your bleeding, if it's heavy, call me back. The answer is C. Lie down, massage lower abdomen. If it does not work, to the hospital immediately. 808. A 15-year-old girl is admitted after a motor vehicle accident. Child has a fracture in her left leg and a wound in her face. When dealing with this child, the nurse should be aware that important task to achieve during this age is which of the following? A. Initiative versus guilt. B. Industry versus inferiority. C. Trust versus mistrust. D. Identity versus role confusion. The answer is D. Identity versus role confusion. 809. A 9-month-old child who has a repair cleft palate. The nurse explaining mother on how she will give feeds to her child. Which of the following instruction can be expected to include feeding education? A. Open cup. B. Teaspoon feed. C. Bottle feed. D. Special bottle feed. The answer is A. Open cup. 810. A nurse calls together an interdisciplinary team with members from medicine, social service, the clergy, and nutritional services to care for a patient with a terminal illness. Which of the following types of care would the team most likely be providing? A. Palliative. B. Curative. C. Respite. D. Preventive. The answer is A. Palliative. 811. A nurse 1, preparing to assess the uterine fundus of a client in the immediate postpartum period. When the nurse locates the fundus, she notes that the uterus feels soft and boggy. Which of the following nursing interventions would be most appropriate initially? A. Massage the fundus until it is firm. B. Elevate the mother's legs. C. Push on the uterus to assisting expressing clots. D. Encourage the mother to void. The answer is A. Massage the fundus until it is firm. 812. A 43-year-old man in the post-surgical area complains of abdominal pain radiating to the navel, which is increasing with examination. His abdomen is guarded with marked tender lower quadrant. What is the immediate goal of care to do? A. Teach abdominal splinting during coughing. B. Administer pain medication as ordered. C. Assess pain and report immediately. D. Position on the left lateral side. The answer is C. Assess pain and report immediately. 813. 27-years-old female brought to the emergency room accompanied by her husband. He described that she had marked weight loss, with episodes of emesis in the past 3 months. She is diagnosed as having anorexia. She reported feeling febrile, but had not measured her temperature. Her white blood count was 11,000/mm3. Which of the following most likely describe her diagnostic criteria for her anorexia? A. Restricting food intake. B. Fear of gaining weight. C. Problems with body image. D. Binge eating disorder. The answer is B. Fear of gaining weight. 814. 66-old woman presents to the emergency department triage unit with labored breathing. She appeared anxious and is sweating profusely across the forehead. The symptoms had begun suddenly 1 hour before. The jugular veins appear distended and she has a productive cough. On auscultation, the respiration is wet and not clear with coughing. Blood pressure 148/88 mmHg, heart rate 94 per minute, respiratory rate 26 per minute, temperature 37.0 degrees Celsius. Which triage acuity rating is most appropriate? A. Urgent. B. Emergent. C. Non-urgent. D. Resuscitation. The answer is B. Emergent. 815. A nurse is providing a health teaching to a client about the proper use of a cane during ambulation. The nurse could include which of the following instructions about the correct use of cane? A. Patient moves the stronger leg forward to the cane. B. Patient holds the cane on the strong side of the body. C. Patient leans on the cane to provide support to the weaker side. D. Patient moves the cane forward about 4 inches to the strong side. The answer is B. Patient holds the cane on the strong side of the body. 816. A child with jaundice and treat with photography. How can you protect the child's skin? A. Avoid oily substance. B. Using Vaseline after skin cleaning. C. Applying cream. The answer is A. Avoid oily substance. 817. A nurse is caring for a patient 2 hours after a pacemaker placement. The patient suddenly starts complaining of chest pain. The nurse observes dyspnea, cyanosis, and absent breath sounds on the right side. The nurse should anticipate what complications? A. Hemothorax. B. Perforation of the heart. C. A pneumothorax. D. Hemorrhage. The answer is C. Pneumothorax. 818. Which of the following could adversely affect the function of a pacemaker? A. Hair dryer. B. Electric razor. C. Television. D. Electric mixer. The answer is D. Electric mixer. 819. The nurse provides discharge instructions to a client after implantation of a permanent pacemaker. The nurse should tell the client to avoid exposure to which item? A. Hair dryers. B. Electric blankets. C. Electric toothbrushes. D. Airport metal detectors. The answer is D. Airport metal detectors. 820. The nurse provides discharge instructions to a client after implantation of a permanent pacemaker. The nurse should tell the client to avoid exposure to which item? A. Hair dryers. B. Electric blankets. C. Electric toothbrushes. D. Electric mixer. The answer is D. Electric mixer.